On March 11th, 2024, Jessica Pettway, a 36-year-old beauty influencer known for her hair tutorials on YouTube, passed away in a hospice facility in her hometown of Georgia of cervical cancer. After being misdiagnosed with fibroids for 7 months, she was hospitalized for extreme bleeding and abdominal pain that she referred to as labor-like. She was finally referred to an oncologist who diagnosed her with stage 3 cervical cancer. Black women are 41% more likely to develop cervical cancer than white women and are 75% more likely to die from it. Just after hearing this news, I came across an Instagram reel by Dr. Kemi Doll. Dr. Doll is a physician, surgeon, researcher, advocate, and coach who has made a permanent mark in gynecologic oncology.
So I don't usually do videos like this, but I have a lot to say about this, most of which won't be covered in this video, but this is about the story of Jessica Pettway, this gorgeous beauty influencer who just recently died of cervical cancer. And when you say those words, that is ridiculous. Like, as a gynecologic oncologist, it's ridiculous. And I always feel so sick to my stomach when I say X person died of cervical cancer, because it's a 100% preventable cancer. So with a combination of vaccines and early detection and pap smears, those two together, we should not have people dying of cervical cancer. But Black women die of cervical cancer at higher rates than other groups. And there are a lot of reasons for that, but I think the story of Jessica Pettway shows you how even when Black women get the sense something's wrong, something's off, and go in, she describes multiple different encounters where she's diagnosed with fibroids, and her bleeding is attributed to fibroids, and there isn't any further workup or evaluation for, like, I think it's at least 6 months or more. And so this hit close to home because this is exactly the research I do around endometrial cancer and delayed diagnoses and the problem of Black women having a 98% higher mortality than everybody else from a cancer in the womb. So much more to say about that to come. But with this, I just want to say that reproductive health care is more than pregnancy. Your reproductive well-being goes beyond whether or not you are pregnant. And we need a radical shift in how we think about our gynecologic health for Black women, how we advocate for that, and how we demand better care around that, because there are multiple layers of systems set up to devalue specifically the non-pregnant Black womb. It's almost like it doesn't exist at all, except we know it exists because Black women who are not pregnant are suffering and dying every day unnecessarily because we have not prioritized the entirety of gynecologic health. More to come, and my deep condolences to Jessica Pettway's family, and I hope that this encourages you, if you're listening, to schedule that annual exam and to take your gynecologic health seriously, because it matters, and I think for Black women, might be the most central part of your health. More to come.
Ryan Reynolds here from Mint Mobile. With the price of just about everything going up during inflation, we thought we'd bring our prices down. So to help us, we brought in a reverse auctioneer, which is apparently a thing.
Mint Mobile Unlimited Premium Wireless. How to get 30, 30, bit to get 30, bit to get 20, 20, 20, bit to get 20, 20, bit to get 15, 15, 15, 15, just $15 a month? Sold!
Give it a try at mintmobile.com/switch.
$45 up front for 3 months plus taxes and fees. Promo rate for new customers for limited time. Unlimited more than 40 gigabytes per month. Slows full terms at mintmobile.com.
Host the ultimate backyard barbecue with Whole Foods Market. It's the Hot Grill Summer event through July 16th with sizzling sales on no antibiotics ever boneless beef ribeye steak and beef New York strip steak. Plus, check out sales on sustainable wild-caught Alaska sockeye salmon. organic strawberries, and more. In a hurry, choose grab-and-go favorites like picnic salads and sushi, plus plenty of cooler-friendly beverages. Make it a hot girl summer at Whole Foods Market.
Okay, so in this video, I can see like frustration, urgency, and you start off saying, I don't usually do videos like this, but I have a lot to say about this. And I was like, I am sending you a message because I want to talk about this, because there is something about seeing that. And as a person who, I was very familiar with Jessica Pettway from my years of doing curl box and sharing her images. She was so stylish. Her hair was always on point, and she did it herself. And I knew there was a period of time, I know she was in like LA. And so I felt so connected to her in a way that I think so many people did. Mm-hmm. And you started off saying that this is a 100% preventable cancer. And I feel like was that what like sent you first? But you have a lot to say, and I want to hear what you have to say. So welcome to the podcast, Dr. Kemi Doll. I got it.
Wow. First of all, thank you for having me. Thank you for being here. I have so many feelings about this.
Yes.
So many thoughts. And you're right. I usually don't. That was really like people who follow me know I don't really usually talk about health related content.
Okay.
And things. And we can go into why and that. But I did feel very frustrated, very angry about what had happened to Jessica Pettway. I was not familiar with her, so I was not in the beauty space or anything like that. So I was one of the people who found out because the story went viral, right? And everybody was talking about it in that sense. I was angry. Yes. Number one, because cervical cancer is 100% preventable. We have had a cervical cancer vaccine that prevents the way that cervical cancer happens is that you get infected with HPV virus. HPV virus is everywhere. It is ubiquitous. I tell people like it is technically sexually transmitted, but the way that we think about it is like basically if you've touched somebody, you have been exposed to HPV at some point. Okay. So it's really important to understand that it's not like it's one of these things that like if you're very careful, you'll never get it. It's not like that. We collapse so much of gynecologic health, sexual health into these very binary black and white categories. Are you a good girl or not? Did you ever do this or not? And it is so detrimental. So HPV is one of these things that like, if you're living, breathing, touching people on this rock, on this spinning rock of earth, on this planet, you have been exposed to HPV. Okay. That's important for people to understand. There are a few strains of HPV that can eventually cause cancer. They integrate into the DNA in cells and they cause a cervical cancer. So the reason why I got so upset about Jessica Pettway is two things. One is that cervical cancer, first we have a vaccine so that if you get the vaccine, if you get those types of HPV, if those types enter your body already knows how to get rid of them. So it's like your body has the key because you've gotten the vaccine. When it sees that HPV, it's like, oh no, girl, like we know this is everywhere, but you cannot stay, right? You can't stay. Like, thank you for coming in the door. Please see your way out. Okay. So there's no opportunity now to be able to have the virus stick around and stay forever. But the second reason I got mad, even outside of the vaccine, which we have now had for like over a decade and really is something that is working very well to decrease cervical cancer rates, is that cervical cancer is also a slow growing cancer that has many stages to be able to find it before it gets to the point where it threatens your life, my leak. Okay. So that is the reason why we have the pap smear, which was developed in the 70s. Okay. But sorry.
I know. I was like, I know you're going to go there, but I'm going to slow the train just for a second.
Thank you. Slow me down.
Because when you start talking about the vaccine, I think it's very important to call out that it's the HPV vaccine that prevents cervical cancer, which to me, I feel like it's important to say because like you said, it's like, well, how will I know or care about HPV? You know what I'm saying? So I think there is something about being like, do you want to be vaccinated for HPV? And it's like, who do I know that's gotten HPV and talked about it? So
that's exactly right.
Right.
I agree with you. It's a failure of the public health strategy, honestly, which is a whole other rant. Because it's like, if you tell people, do you feel like you need an HPV vaccine? They're like, I feel like this is not an issue. Right. Exactly. Like, nobody's told me that they struggle with their HPV. Right. So you don't think about it. It's not, would you like a vaccine that prevents what used to be the number one cause of gynecologic cancer death in this country?
Let's talk about it like that.
How about that? Right? Can we talk about it like that?
Yeah. I mean, they literally just come in with a check. You know, it's like, okay, so do you want to get tested for HIV? Do you want the HPV vaccine? You know, are you pregnant? And you're like, no. And anytime you say vaccine, I think in our community, you understand why that is.
I know.
If it's not, does it feel necessary? Do I need this?
Yeah.
And so that's why I really just want to have you talk to us before we move on to because then I want to talk about how slow this cancer goes with the pap smear. And for those of us that might be missing our appointments and there's a little bit of confusion. I do want to tell you, there's confusion about like,
when do I have to go?
When do I have to go? Like, you know, it's like, is it every year? It's like,
the guidelines keep changing. Yes.
When I tell you, it's like, okay, so I don't need one every year.
Right. Like what? Yes. Okay. Yes. I understand. We can get all into it.
So I want you to spend some time on the HPV vaccine and just dispel as much as you possibly can, because until you just said this to me, I did not know that the HPV vaccine would help me not get cervical cancer. No one has ever said that to me, and I am 45 years old.
Exactly. And I believe you, which is my indictment, honestly, of how we think about gynecologic health and the fact that women's health is like only encapsulated in pregnancy. And it drives me crazy because it's important. But you know how much time of your life you spend pregnant versus not pregnant?
Right.
Those organs don't disappear when you're not pregnant. They're sitting there and they need to be healthy. But we have no concept around that other than maybe do you have an STD or not? Like, anyway, bringing it back. So I fully recognize that like saying the word vaccine out loud is like enough to like light people on fire. You know what I mean? Like I get that. And it's honestly part of the reason why I don't spend a lot of time talking about health things online and things. You know, I do that through my research. I do it through my science. I do it through papers and things like that. I don't really wade into that world. But I was so angry that day because, yes, to clarify, cancers is like a really broad term for a lot of different things that can go wrong in the body that end up at the same endpoint, which is that you've got cells in your body that are just growing wildly out of control and they've mutated and they just have like no checkpoints anymore. They're out of control, right? But there are a lot of different ways that they get there. There's all kinds of different causes that get them there. In cervical cancer, my leak, the cause of what creates those cells in the cervix is the HPV virus that somebody gets infected with and their body does not clear. It doesn't go away. It sticks around.
Okay.
It stays and stays. And eventually it integrates into the DNA and it starts to cause mutations that cause cervical cancer. The HPV vaccine works because before you are ever exposed to HPV, i.e., when you are a child and you get an HPV vaccine, your body now knows exactly what the cancer-causing HPV virus strains look like. It's like it's got a clock on it. Okay. So anytime those things enter your body, you automatically clear it out. It doesn't have an opportunity to stick around and cause problems.
Okay. It said you thought.
It's like, it's like, oh, you thought, like, never mind. I'm sorry. So when people ask like, well, I don't understand why are we giving this to kids? Like, that seems wrong. HPV is like a sexual transmitted thing. It's like, because you need to get it in before there is any opportunity for exposure. And I'm not trying to ask people about their lives and all sorts of stuff like that. But the bottom line is people be touching.
You gonna be touching.
Yeah. So the goal is not to identify like, oh, your daughter is going to start messing around with people at the age of 9. It's to say, let's go so far back so we know there's nothing going on. Right. It's like, that's why we're not going to guess it's 16 or 21 or whatever. We're like, just round up all the 9-year-olds and get them going.
Right.
You see what I'm saying? Yeah. And I should say, I say daughter, but this is also why it's boys and girls vaccinated because everybody is exposed to this. It's not, one or the other. So is that clear? So that's why it's a vaccine that prevents cancer. And just to step back for a second, Miley, that's incredible.
Yeah.
Think about how scary cancer is. Think about how much we do every day. We're constantly, how do we do, like, it is like this existential threat that a lot of people have, especially as they get older. Like, how do I stop this from happening? Like all of these things. This is one of the very few cancers that we have figured out scientifically how to prevent. That's incredible.
Yeah, it is. I mean, early. Yes.
Okay.
So, thank you for that.
So does that help?
That is very helpful because I'm telling you that until just now, that's why I didn't want to talk to you before. Until just now, I did not know this. And I don't know if there's I don't know if any person at any appointment has ever explained it to me.
No, I believe
so it was important to me that I talked to you because everybody was in an uproar, and like I understand why you just don't want to come on pontificating in the middle of something like that, which is why I'm glad we had some time to like let our heightened emotions kind of settle in for just a second. And now it's like, what are the actions? What is the knowledge from someone that we can trust? And you are someone we can trust. And the next thing I want to talk to you about is just, let's just put this out the window. Okay. You didn't get the HPV vaccine. You didn't.
Yes. I was about to go there.
Yeah. Let's just say you don't have it. You didn't get it. And you said this is a slow growing cancer, which I could tell further pissed you off.
Yes, it did.
So talk to me. Okay. Talk to me.
Okay, so I feel like I have to say that that in subsequent studies we have found that you can still give the HPV vaccine to adults, and it still decreases your chance of dealing with cervical cancer and what we call precancerous conditions also going forward. So I got my vaccine deep into my adulthood because that's when they figured out how to do it. So I just want to let people know if you want to do it, you can still get it done if you like.
Oh, nice. Yes.
Which is really nice. The other thing, and you can cut this, Miley, if you, I feel like I have to say that like that even in the history of the vaccine, right? When the vaccine was developed, it was focused on the kinds of HPV strains that are more likely to affect white women and not people of color, not Black women. And it took more years and more development to get the vaccine coverage to the types of HPV that are more likely common to infect Black women. So I always just want to like acknowledge that the racism is never gone.
Yep.
It's always there. But it does work now for us.
You like just to let you know.
Yeah, just to let you know.
They checked our box with it.
We did check our boxes. Okay, so moving forward, it's a slow growing cancer. So what a pap smear is, like if I may take it all the way back, if that's okay. Is that like I mentioned how cancer is like this series of errors where you start off with like a normal cell, like a normal functioning. I know what I'm doing. Like I'm this kind of cell. Every single cell in your body is programmed to grow, do its function and die and then replace itself. What happens with cancer is that over a series of like multiple mutations, basically the cell keeps changing just a little bit more, a little bit more until it is so wildly different from where it started that it doesn't have any more turnoff signals. Okay. It just grows wildly. Like as a very crude metaphor, right? Think about like maybe a pop star, maybe a rap artist that you know that like seemed like they were okay and then like increasingly get wilder and wilder and wilder to the point where you're like, you know what? I don't even recognize you from the person that we started with. That's how I think about it, right? So what a pap smear does is a pap smear takes a sample of the cells from your cervix and it looks at them and it's like, are any of these starting to get funky? So we look under the microscope and we're like, are we seeing any of those early changes, early things that are like, wait, this cell we getting off track. What's going on? That's what a pap smear does. Okay. It generally takes years for the cells on the cervix to go from totally normal to cervical cancer, which is why getting a pap allows us to check and see those changes earlier and be like, ooh, girl, you got these ones are going off track here. We need to remove this area maybe we need to give you the vaccine if you haven't had it yet. We need to watch this area and make sure that we're going to help your body clear out these abnormal cells.
Okay.
That's basically what a pap smear is doing. So a lot of women will tell me they've had these experiences where they're like, yeah, they got a pap. It was abnormal. You know, they saw something and I had to go in and get a colposcopy, like another thing where they looked in a little bit more specifics and maybe they did a biopsy or something. And I'm like, that is perfect. What they're doing is they're going in, and before it gets to a point where it threatens your life, they are getting rid of any abnormalities there so you can move on with your life.
Okay.
Does that make sense?
That makes perfect sense.
Okay.
So you're saying, now tell us what are the rules today of how often we should have them?
Thank you. So first of all, I want to tell you that the rules are so complicated that I don't actually know any physicians who could just list off the rules to you like this, like off the top of the dome, because they get so complicated in terms of age, were you vaccinated or not, some of your history, have you ever had any abnormal cells before or whatever. But I'm going to give you like high level for folks. I'm going to give you high level.
Okay.
Number one, the HPV test is what changed us going from like, you have to get your pap every single year to realizing, oh, if actually we test you for HPV right now. And even though this thing is everywhere all the time, but you don't have it right now, that's actually a really good signal that you're good for longer than just a year. Okay. Because of how long this thing takes to act up. Okay. So that's one reason why you might be told, oh, you know, we did your pap, your HPV was negative, you're good, you can come back in 3 years or you can come back in 5 years. It's not wild in terms of reassessing the cervix itself, okay? Mm-hmm. A lot of women are either going to be on an every 3 year or sometimes on an every 5 year pathway, because we can both look at the cells on the cervix and we can do the HPV test at the same time. Okay. I say all that is that what I think happens sometimes that gets people confused are two things. Is one, what I just said, that like, oh, now come back in 3 years, come back in 5 years.
I know.
Everything's fine.
Yes, that's where I messed up.
Not only my leak that, and that's also if nothing changes in your life. Yeah. So if you are like in a committed relationship, ain't nobody going anywhere, nothing's happening, there's nothing new, there's nothing like that, there's no new exposures, then you can hold on to that. I was HPV negative, everything was clear, I'm going to be back in 3 years. But like,
hold on.
Okay.
But so this is where I want to interrupt, because this is where I kind of like messed up, is that it's like, okay, my pap is fine. Mm-hmm. She's like, but you still need to come back every year. Yes. You may not be getting a pap every year. Yes. But you need to come for annually. Yes. Getting a pap or not, you need to be at the gynecologist office.
The annual exam is way more than
annual exam pap. Doesn't necessarily, right. And I think that was another thing that it's like, oh, I'm going to the gynecologist for my annual exam. That includes a pap. And it's like, well, if you say I don't need a pap, like, then what do you
I'm not going
for?
Yeah.
Right.
Super common. Also, I highly relate. So it's like, I'm not talking from a pedestal.
They called, they called like, are you coming? And I was like, I thought you said it was good.
Yes. Yes. And it's like, no, like, so again, these are organs in our bodies that actually are pretty active if you think about it. Like if you think about what they're doing every month, you know, if you think about the different phases of life, there's a lot going on there. Mm-hmm. And the pap is important. And I think we kind of went left as a field in organizing the whole annual exam around the pap, because once we moved on and got better with assessing people's risk, so they didn't need it every year, it's like everybody thought there was nothing else to do. Yeah. And it's like, no, we got, it's not even just your gynecologic organs, your breast evaluations, risk, family history changes, other things that might be going on. Like you can have other diagnoses that might come on board that affect your reproductive organs. And because of the misogyny in the healthcare system and the way we teach medical education, OBGYNs are like the only people who know anything about what's going on with those organs. So you might have a totally other diagnosis, but nobody's going, hey, by the way, how does this affect your uterus? Except your OBGYN. So like that's another reason. So like there are these things that happen in our lives and we don't think about, oh, but this could have an impact on what's going on down there. In addition to just the health of those organs. there are things that happen with our ovaries. There are hormonal changes. There are all of these things that are worth assessing. And then you have like, sexual health. You have your, mental health that's related to your pelvic organs. Like there's just so many layers, Myleik.
Yes.
And so I think that day when I went on and I was like, all right, I'm going to talk about this because I'm so upset, is like, it was this moment where I was feeling like, okay, one, this woman should never have died of a preventable cancer in 2024. Like it hurts my heart so badly. Number two, we only talk about gynecologic health, these organs, when something like this happens. And that's also part of the problem.
Okay.
It's like they're not even in, it's not even in our imagination. Am I pregnant or not? And then that's it. And so those were the two things that were kind of driving me that day.
Yeah.
And something we haven't talked about also is like the delay and like the dismissal of her symptoms and things like that.
Host the ultimate backyard barbecue with Whole Foods Market. It's the Hot Grill Summer event through July 16th with sizzling sales on no antibiotics ever boneless beef ribeye steak and beef New York strip steak. Plus, check out sales on sustainable wild-caught Alaska sockeye salmon, organic strawberries, and more. In a hurry? Choose grab-and-go favorites like picnic salads and sushi, plus plenty of cooler-friendly beverages. Make it a hot girl summer at Whole Foods Market.
I'm sure we'll get into it.
Yeah. I mean, I have questions for you that are just like general, but I think that taking a topic and ensuring that it doesn't happen in vain and doing something with the fear many of us had that day, because I don't know anyone who has ever, I think social media has changed the way we watch someone die, and I think her sharing along the way, being on the ground, the things that she shared.
Yeah.
And, like you said, her symptoms being ignored. And a part of me doing this podcast and even coming back after being on hiatus for several years is like, how can I serve?
Yes.
And to me, I think that having access to experts like yourself to make it plain, that is really important. And so I am going to just something that has been helpful in speaking to doctors on this podcast in the past has been advocacy, things that we don't know we can ask to have done.
Yes.
Ways that we can push back. Is there anything, are there special tests? Are there, what can we have in our phone notes when we go to an appointment or making an appointment? Like, I want your best game for us.
Yes. The first thing I have to say is a high standard for who your doctor is. And I know that is somewhat of a privileged thing to say. Like, I get it. So I'm acknowledging that. But like, there are a lot of us, we have high standards for who we're going to for therapy. We have high standards, right? For like, who is allowed to do our nails. Like, we have high standards for these things. And I'm like, I want you to have that same energy for who you're going to talk to about your gynecologic organs, that womb, the uterus, your cervix. I want you to have that same energy. I want us to think about it that way, because it is very difficult actually to engage and advocate for what you need, et cetera, if you're at a low quality health setting. If you're in that kind of local, that's like, we don't need that. So that's number one. Number two is, one, I want people to be able to establish a rapport with their gynecologist about what their normal looks like. What is their normal? A lot of times, sometimes it's like people go because like they're in some crisis point. I've been bleeding for 3 weeks. I'm like, okay, first of all, please go. Like that is not, we got to do something about that. But second of all, it's so much harder actually to figure out what's going on when you don't have somebody's normal. So again, just to relate it back to like mental health, somebody shows up in the therapist's office, they're totally in crisis. It's a lot harder for that therapist to figure out like what triggered you, what happened if they don't know you at your norm, right? So that's my one. So that's like the first piece is like, have your goal not be, I have to solve this problem right now, but like, let's me and you get on the same page of what normal looks like to me.
Yeah.
Number two, that will help you find out whether your normal is within what we call a medical normal,
or whether we're like, girl, that might be your normal, but you are suffering.
Right.
That is not like...
Which I think is so common in our community sometimes when you're talking to people about their experiences. And I just had said this today, just because you are used to something does not make it acceptable.
Exactly. Just because you can handle it doesn't mean you should have to. So
we can apply that to everything.
Yes.
Everything.
Sure. Yes. Like, I think there's so many lessons in our womb, I think. Anyway, more to come. But
lessons in our womb.
Okay. So
all right.
What I would say is that, so that's the first thing, is like getting that really clear, and then being able to have a conversation about like, okay, that might be my norm. Let me ask, like, how does that fit within the expectations? You know, like, am I bleeding a lot more than I ever really should be? Is the irregularity that I call this is just me, like, put me at risk for things later? My research area of expertise is in what's called endometrial cancer, which is a cancer of the womb. It's of the inside of the uterus, not the cervix on the outside. Most people don't know that a risk factor for that cancer is very irregular periods over their life. So like, you're like, well, this is my norm. It's cool. Like, I know it's irregular. It's all good. And I'm like, how many years have you been living with this major risk factor for this cancer that kills Black women at a 98% higher rate than other women?
You just gave me chills.
Yeah. So my second point of advocacy is like, I want people to come in with that curiosity, is like, this is my norm. It's not, I'm not saying you can't handle it, but let's assess this against risk factors for things in the future that I might need to worry about. And, you know, what's a medical norm in terms of like, this might be outside of what you need, what you have to be dealing with. Like, we could have a better quality of life here. Yeah. Number 3, I think understanding as much as you can your own family's history about like transitions around menopause, what age that happened, what that looked like, will help you be able to be more ready for when those things might happen in your life. In Black communities, we don't talk about this very much. No. We also have a really high rate of hysterectomy at younger ages that has robbed families of that natural process. So they don't even know. It's like, well, everybody in my family had their uterus out by 38. So I can't tell you anything.
Right.
And I'm like, okay.
There's no medical history.
What is the history? Right. There is no history.
What is the history?
So being able to, yes. And that also goes with some of the cancer, like some of those issues. So people will be like, well, we don't really know. We don't know where the cancer started. We just know eventually it spread to whatever. And like with investigating, and they go ask their family members, and it finds out, oh, we've had 4 women in our cancer die of uterine cancer in our family, excuse me. And I'm like, wait, like, so understanding a little bit better about the gynecologic conditions that run in your family, including the cancer ones, is also a place where you can then start doing some like risk mitigation. Okay. So that was I kind of started with just like information that's helpful for you. What is your norm? Sharing your norm with your doctor, understanding whether like how that fits in with what we think about in terms of medical risk and not, and then understanding your family history as much as you can and how you need to think about your potential risk going forward. The next layer is for people who are kind of coming in and they're like, okay, I already know I don't like what's going on. Maybe I have pain. Maybe my bleeding is crazy. Maybe whatever. Right. I think the biggest thing I can say is, one, this is where it goes back to having a high quality doctor that's listening to you, that's talking to you. The second thing I want everybody to advocate for is a board certified obstetrician and gynecologist when you are talking about gynecologic hormonal health issues. Okay. Again, in medicine, and I just need to emphasize this, it's not okay, but reproductive and gynecologic information and clinical training is almost completely siloed to only our field. It is wild how much all kinds of other doctors do not learn about these organs. Right. So if you're having those kinds of issues, I want you to talk to somebody who spent 4 years of medical school and 4 years of clinical training, if not more, another 3 years for the endocrinology specialist who knows and can talk to you about all of these fluctuations, et cetera.
Okay.
I don't even know what number I'm on, my leak.
It's okay, honey. We'll take it. A
really powerful question when you're talking about gynecologic symptoms, because there's a lot of things. There are a lot of symptoms that can be caused by a lot of different things. So that's what can be challenging. I think it's interesting, but it can be challenging about gynecology is like one person's having bleeding for this reason, you're having bleeding for a totally other reason. You know, this person has a polyp, you have atrophy. This person has a fibroid. This person has adenomyosis. Like it is so wide ranging, right? So it's like a detective, like you have to sit there and be really thoughtful about it. So you want to be able to ask, what is the differential diagnosis? That is a phrase we use in medicine that says, what are all of the things that you're considering this could be? And then what are the actions we are going to take to rule out each one? So you ask for language, you ask for a toolbox. If you're coming in and you're like, this is the problem I'm having. Maybe I'm, over the last 6 months, pain with my periods has gotten out of control. Like it doesn't even make sense. I've been thinking it's stress. I've been thinking it's this. I've been thinking it's that. All of these things might be related, but like what is going on? You can ask, your doctor might say whatever, but you can ask, okay, what is your differential? That is medical terminology for what are all the things that you're considering this could be. So then now you also know as a patient, now you know, okay, this is the list.
Yeah.
So now I'm following. When we're trying different things, I'm following too and checking off, okay, so it wasn't that, it's not this. So if they say, okay, let's get an ultrasound, you understand what we're looking for. Okay, that will click us off of this. So we actually have these rubrics of how do you think about somebody who's coming in with abnormal bleeding? Again, because it could be like 20 different things. So we have rubrics for how we think about it. Same thing with pelvic pain, et cetera. But oftentimes, doctors don't talk, they don't share, they don't walk through their thought process. So you don't know all of that. Right. And so what I find happens with Black women a lot is like, I came in, this was a symptom I had. They, quote, threw hormones at me and that was it. And there was no other conversation. And I'm like, that is such a failed opportunity because now you don't know all the things they were considering. They don't know, like, they're not telling you what we think this may or may not do. Right. So now nobody has really gotten better, but I really like understanding the process. I have found with my patients, like when I was treating them, like if they understood all of the different, components we were working through, then they were like, okay, I'm clear. And in fact, I could be more impatient than that. I'm like, okay, we need to figure. And they're like, you know what? No, I think I understand. Since we're still figuring this out, let me try this out for 3 months. Let me see how I feel. Let me see. So it becomes a partnership of that.
Yes. That was, as you were just sharing. Okay. Oh my gosh. At multiple points in this last time when you were speaking about the differentials and just, I got goosebumps from head to toe because this can change the way I feel when I go into an appointment. And being empowered and knowing instead of like someone talking at me, just being able to show up and participate. Like, no, I am not the doctor, which is why I'm here. But like you said, if somebody's just throwing these things at me, you're recommending these kinds of medications, it is also tricky. And I think, like you said, because of how there's just a level of shame attached to this part of our body.
Absolutely, Myleik.
Yeah. And it's like, did I cause this?
Right.
Was there something I did? Did I not do something right?
Right.
And this is something that is just, it's important to me. And so I want to thank you times 1,000 for, number one, your passion, and number two, your transparent sharing, because this is the only way we're going to learn. And so before I let you get out of here, I just have to know, because we got right down to business. How did you get into this? Like, how are you? It's like, how did you get into this? And I mean, you've taken it. I've seen your website. Like, you ain't nobody to play with. Like, no. respectfully, don't play with her. But like, I'm just curious, how did you get into this? And like, why does this matter to you so much?
Oh my gosh. Okay. So, I'm trying to figure out like where to start, because there's like so many places to start in the story. But I would say the getting closer to like the women's health piece of it. I went to medical school feeling like I was always been very oriented towards kind of like equity and justice, but advocacy, being a lawyer, all that felt like too messy to me. I'm like, I want to be clear about just being able to help people.
Okay.
And if I can help people's bodies be healthy, then I can help them go fight their fights, in this world. And when I got into medical school, I rotated through OBGYN and I thought I would hate it. Actually, I was like, wasn't interested at all. And I just was so amazed at how much it contained. Again, because I came in with the same narrow view. Like, this is about babies popping out and giving people birth control. That was it. So when I got in, I was like, whoa, this is so much more that's here. I was immediately intrigued. And so I went through, my OBGYN training, which is 4 years. And then I decided to do gynecologic oncology, which is the specific specialty around cancers of the female reproductive tract. So cancers of the womb, the tubes, the ovaries, et cetera. I decided to focus on that because, again, I didn't actually have those things in my imagination. I was like, how come this isn't common knowledge about all of these things that can happen down there? Yeah. So I was pulled in by that. And I think I'm a person that is naturally into like deep conversations that are meaningful. And like, there's something about being with people when they're facing a cancer diagnosis, when they're facing like the threat, that mortality threat, that something rises to the occasion in me in a way that is very like, this is what I'm supposed to be doing. I'm here to witness this. I'm here to help you walk through this path. The reason why I'm the person I am now is because it wasn't until 7 years into my training, 7 years, that I realized how much more Black women suffer and die from all of the conditions I was learning about. And when I asked, I was like, wait, what? Why? Why are Black women twice as likely to die from this? Why do Black women have 30% more of this? Like, why are all these? And the answer would be like, we don't really know. It's just how it is. And I was like, what? How do we not know? So we don't know because we don't care. But that's really what ignited my passion to go beyond like one-on-one clinical care to say, I'm going to research this. Like, I am going to start to understand this. I'm going to start to unpack this. And I want to make a difference so that it is not normal for us to throw Black women away once they're not pregnant anymore.
Come on.
I was like, this is, and so it really became something very deep in me, like very ancestral, very like, I feel like I'm fighting for the dignity of our lives. Yes. I'm fighting for the fact that we are more than one note. Yes. I recognize the history we came from. Like, we were reproducing, the engine of capitalism in this country through slavery. And as soon as that's gone, nobody cares about our reproductive organs anymore, right? Nobody cares about the health of them. What they used to examine enslaved Black women to ensure that those organs were healthy enough to make a bunch of babies. The minute that's gone, nobody cares anymore. All of a sudden, you know what I mean? It doesn't matter. And so I just feel like this is how I got to how I am. Like, beyond the details of the research I do and like all the things that we do, it's like, because I am fighting for the dignity of Black women's lives. And I want that to include, healthy gynecologic health throughout their entire lives. I'm not interested in throwing Black women away and throwing their health away once a baby pops out and we're like, okay, you're done.
We are grateful for you. We really are. And I hope that you know that. Like, I am beside myself with just emotion because people like you are how we will be saved. So thank you so much.
Myleik, thank you so much. You gave me no room here to just fangirl a lot and tell you how you have inspired me in many ways and how much you show up so fully as yourself, so unapologetically in the moment that you are in at any given time has been really healing for me to watch and has expanded my freedom. Like, I was able to post that reel that day because I spent years watching you show up and just be who you are and say what you have to say. So I just wanted to say thank you too.
Thank you. Y'all always try to get me. I try to get us out of here and then you catch me. So thank you.
Yes.